Senator Alexander, then followed by Senator Manchin.
Thank you, Mr. Chairman. Welcome, Mr. Secretary. Mr. Secretary, I want to use my 5 minutes to talk about the Tennessee plumber who's making $60,000 or $70,000 and paying $20,000 for health insurance, or the farmer named Marty who came up to me in a Chick-fil-A and said my monthly premium was $300 a month and now it's $1,300 a month. It has gone up under Obamacare that much. I could spend the whole 5 minutes talking about my disappointment that we could not agree on our proposal supported by the President and Senator McConnell and Speaker Ryan to reduce those premiums by up to 40%, according to independent experts. That would have meant a $20,000 premium could have gone down to $12,000 over 3 years. I think we've now conclusively proved that Democrats and Republicans can't agree on changing a single sentence of the Affordable Care Act. But you appear to have found a solution, and I want to make sure I understand it, with your proposal for associated health plans. Now, the plumber and the farmer are part of 9 million Americans who aren't eligible for subsidies under the Affordable Care Act. So they're in what we call the individual market. People who are in Medicare and Medicaid get some government subsidy. More than half of Americans get their insurance on the job from employers. And my figures show that the subsidy they get is about $5,000 a person because, in general, spending by the employer or employee on employee insurance is exempt from income or payroll taxes. Does that sound about right to you?
Senator, those strike me as reasonable numbers.
So the difference between someone who gets insurance at IBM and someone who's self-employed and paying for their own without subsidy starts out with a roughly $5,000 cost differential. So we could lower the cost of health insurance by $5,000 if we could find a way to make more of the small business people or self-employed people, the farmer and the plumber, eligible for the same kind of insurance that large group people have. I assume that's your objective.
Senator, that is the objective. We have what we call small group plans.
Now, let me go a little more rapidly because I've only got 2.5 minutes. What we're not talking about are the short-term limited duration insurance plans. That's something else, right?
Something else.
We're talking about giving small employees of smaller businesses the same kind of insurance coverage large employees of large businesses get.
That is correct.
That would mean local bakeries from Nashville or Phoenix could band together, or Uber or Lyft drivers could band together and get the same kind of coverage that employees at IBM or Walmart enjoy. Mr. Secretary, would the new protections afforded by the Affordable Care Act for the large group market, the Walmart, IBM people, apply to the associated health plans you propose?
Senator, the association health plans as proposed would be in the large group market. Therefore, the answer was the protections of the large group market.
Give me a shorter answer as you can. Just as under the large group market, an association health plan would be banned from charging patients higher premiums because of a pre-existing health condition, yes or no?
That is correct.
Just as under the large group market, an association health plan would not be allowed to ban or deny coverage of a pre-existing health condition.
As proposed, that is correct.
Just as under the large group market, an association health plan would be required to offer coverage to dependent children up to age 26.
As proposed, that
Just as under the large group market, an association health plan could not cancel an employee's plan because the employee got sick.
As proposed, that is correct.
Just as under the large group market, an association health plan cannot place a ban on annual or lifetime limits or benefit coverage.
As proposed, that is correct.
Just as under the large group market, an association health plan must provide coverage of preventive health services free of charge to the patient. Is that correct?
As proposed, that is correct.
So, in effect, your proposed rule would give the same opportunities and provide the same protections to self-employed Americans and Americans working for small businesses that are available to people with coverage from large employers today.
Senator, that is the crux of the proposed rule.
So I could say to the plumber and to the small farmer in Tennessee that if they could, under the terms of your rule, associate with others in similar professions and meet those qualifications, that they could buy the same sort of insurance with the same protections and at the same cost advantage that the IBM or Walmart or large group employee of a large group has today. In other words, the small percentage of people in the individual market who pay their own way, the 9 million Americans, would have the same kind of health care that 160 million Americans have in large group employer insurance?
Senator, as you pointed out, may I answer, Mr. Chairman? I noticed, as you pointed out, the theme of the proposal, with the appropriate caveats that this is a proposal and not yet final, the theme of the proposal is we have small group plans and large group plans. And within the small group market, there are a number of Americans that don't even have health care because the small business that they work for does not provide health care. So by associating together, they would have access to the large group market. So the employees of the small business would have access to the same market as the employees of Microsoft or any other large corporation, with all the same protections that are afforded those employees.
And the cost advantage as well.
The cost and the cost advantage, which is quite significant between the large group and the small group market.
Thank you, Mr. Chairman.
Thank you, Senator. Senator Manchin.
Thank you, Mr. Chairman. First of all, I want to